Good afternoon. Thank you, Denise, and good afternoon, everybody. My name is Adam Prizio, and I am a staff attorney with the Office of the Healthcare Advocate. Today, I'm going to be presenting on deductibles, cost shares, and how to read your explanation of benefits, which is a document that you get from your insurance company. But first, as always, oh, I gotta click. There we go. In case you're not aware, we are the Office of the Healthcare Advocate, which is a small state office that was created in 1999 under the name the Office of the Managed Care Ombudsman. That name was changed in 2005 to the Office of the Healthcare Advocate. And who we are is a staff of nurse consultants, attorneys, paralegals, and other professionals whose job it is to assist Connecticut consumers with healthcare and health insurance issues. Sort of the classic example of what we do is if your doctor orders a procedure and your insurance company doesn't think it's necessary, they will send you a letter that says, yeah, we know Dr. Smith ordered this, but we're not going to pay for it. And in that letter, they have to tell you to contact us if you would like assistance appealing their decision. And we provide free assistance to the consumer if you are a Connecticut resident or if you are insured through a plan that's written in the state of Connecticut. So today we're talking about deductibles, cost shares, and your explanation of benefits. This is a little preview of what we're going to be talking about. I feel like it's necessary to talk a little bit in broad terms about what health insurance is as distinct from health care. We will, in order to do that, in order to get through this presentation, we'll have to define some key terms. Your allowed amount, your deductible, your co-payment, and your co-insurance. I'll talk a little bit about the information that you can get out of a document called your summary of benefits that is usually at the front of a big, thick booklet that you get from your insurance company or your employer. And then I will talk about how to apply all of this information to read the explanation of benefits that you get after your doctor, your provider submits a claim for something. So the first, the big question is, what is health insurance? And it's important to keep in mind that health insurance is not the same as health care. Insurance is a financial tool that's used to smooth out cash flow. So the classic, I find it easier to simplify things down a little bit in my own understanding. So sort of you buy homeowners insurance every month because you don't have the ability, you have the ability to pay for that premium, but you don't have the ability to replace your house out of pocket if it burns down or something happens to it, right? If you had enough, if you were well resourced enough to just to shrug off the fact that your house burned down, then you don't need to have homeowners insurance, but most of us need to have homeowners insurance. So the same thing is true of health insurance and of other forms of coverage. The premiums, the amount that you pay every month, is based on the likely losses over a period of time, right? So the health insurers look at sort of, we've got 100 people, let's just say, it's going to cost over the period of a year, give or take, like this is what the losses will be, this is what it'll cost. So they have to spread that out among all the folks who are paying premiums. And what you get in return is that instead of always being at risk of owing potentially hundreds of thousands of dollars, if a rare but expensive accident should occur, you pay them a monthly premium, which limits your liability, not for every expense, but for the covered expenses, right? So I want to talk about that next, because the covered expenses are what your insurance actually covers. Sometimes these are called covered losses. You'll see both of those terms there. Plans pay for covered losses. They don't pay for all the losses that could arguably related to health. And going back to the analogy of the homeowner's insurance, in many cases, a homeowner's coverage will replace a roof if it was damaged in a storm, damaged in an accident, something like that. But they won't, in many cases, replace a roof that is not damaged in that way, but that's just needs to be replaced because it's at the end of its life, right? Now, you may need that roof in order to protect the home and the possessions inside of it, but if it's not a covered benefit because it's undamaged in the way that the insurance defines it, then that won't be a covered loss, even though it's a loss to you in the sense that you have to pay for the replacement of the roof. So in the health insurance context, covered losses are healthcare expenses that are covered by the terms of your health plan document. Now, one of the phrases that you will see, and that's going to be important for our presentation, is the allowed amount. And this is the amount that insurance will pay for a particular claim, for a particular loss. It's not necessarily the same as the amount that your provider bills. Where there's a definition here that we took from healthcare.gov. It's the maximum amount that a plan will pay for a covered healthcare service. This may also be called the eligible expense, the payment allowance, or the negotiated rate. If your provider charges more than the plan's amount, you may have to pay the difference. And I've included a note that in Connecticut, fully insured plans, if they maintain a network, right? If there are in-network and out-of-network providers, the in-network providers must, as a matter of law, agree to only charge what the allowed amount is. They're not able to charge you the difference. They're not able to balance bill. Now, out-of-network providers can and do balance bill. Their ability to do so is subject to Connecticut and federal surprise billing restrictions, which we could give another presentation about that, because that's too big for the scope of what I want to talk about today. Once the allowed amount has been determined, the amount that the insurance will pay, that's when your benefits start to come in. And the first piece of information that you need to know when they apply your benefits is your deductible. The deductible is the amount that you have to pay for covered health services before your insurance plan starts to pay. So if you have a $2,000 deductible, for example, you will pay the first $2,000 of your covered services. And then after you pay your deductible, after you meet it, right, you've paid that $2,000, then your plan may call for you to pay a co-payment or a co-insurance, and we'll get to those terms next, and your insurance company pays the rest. And the way that colloquially people talk about this, they say that their benefits have kicked in, right? The insurance company is starting to pay once they've paid or met their deductible. So after you've met your deductible, your insurance company may apply a co-payment, and for some benefits, they may apply a co-payment before you've met your deductible. A co-payment is a fixed amount that's defined by the dollar, right? So $20, $75, $100 that you have to pay for covered services. Usually it's after you've paid your deductible. Some plans are designed differently. But if your health insurance plan if their allowed amount for a doctor's visit is $100, right? Their doctor has agreed to accept $100 for that visit, and your co-payment for the visit is $20. Now, if you've already met your deductible, you pay that $20, and your insurance pays the remaining $80. If you've not met your deductible, then you'll pay the $100, the full allowable amount. And if you're close to meeting your deductible, you would pay up to that $2,000. Let's say you'd pay up to the top of your deductible, and then the copay, and then the insurance would pay the rest. Now your co-insurance is defined a little differently. That's defined as a percentage of costs. So it's not a fixed dollar amount. It's not $20. It's 20%, let's say in this example. So the co-insurance sort of can expand with the actual price of the service, the allowed amount. So if your if you've paid your, if your health insurance plan's allowed amount for an office visit is $100 and you have a 20% co-insurance, then you would pay 20%, which again, in this case is $20 if you've paid your deductible. But if the allowed amount were higher, you would pay 20% of that amount. The next thing I want to talk about is this chart that you get from your insurance company that's called a summary of benefits. And I took this information from a bronze HMO plan that is currently being sold on Access Health Connecticut for 2025. So this shows the plan deductible and the out-of-pocket maximums that you pay. And you'll note it has an individual deductible of $7,000 per person for in-network coverage, and a family deductible of $14,000. So that means that you have to pay up to $7,000 for one individual or $14,000 for cumulative for your family before your deductible is met. You'll notice that this plan does not have any out-of-network coverage. So if you see an out-of-network provider subject to surprise billing laws, you would have to pay the full amount. They're not going to pay anything unless you see an in-network provider. And then the out-of-pocket maximum works the same. It's a little bit higher at $9,000 for the member or $18,000 for the family. So once you've reached these amounts in your out-of-pocket, either for the individual member or cumulatively for the family, then your insurance pays 100% after that for in-network care for this plan. The next thing that you'll see on a summary of benefits, and these I'll tell you that I've cherry picked, right? They're not, this isn't just the first page. I went through and I picked some as a sort of a representative sampling. But you'll see that they cover, the plan covers adult and pediatric preventive visits at no cost, right? No matter whether you've met your deductible or not, your preventive care visits are covered at no cost, which is a requirement of the Affordable Care Act. Your primary care office visits have a $70 copayment per visit. So you don't need to know how much the allowed amount is. You will know it when you get your EOB, but you don't need to know it because you don't have to calculate anything. You can just know this is a $70 copayment. Your tier 4 medications, by contrast, have a co-insurance of 50%, right, per prescription. So that amount will vary based on how expensive the medication is. And the co-insurance is only after your INET or in-network plan deductible is met, up to a maximum of $1,000 per person, or per prescription. So it's for tier 4 medication, it's variable. And there's a little bit of ambiguity in my mind as to whether the maximum is for the allowed amount or for the co-insurance. You know, if I were looking at this plan, I would have that as a question. But in any case, you know that's the maximum that applies after you've met your deductible. Below it, I've put the radiology benefit, which again, there's a copayment per visit, but that's after the deductible is met. Similarly, for physical and occupational therapy, there's a copayment after the deductible is met. And for inpatient hospital services, a $500 copayment per day to a maximum of $1,000 per admission after the in-network plan deductible is met. And you'll note again, there's no out-of-network benefits for any of these specific categories of services, which is consistent with what we saw on the previous page. So when you get your explanation of benefits, and this one I made up because I struggled to figure out how how to give an example without disclosing somebody's health information, and I don't want to do that. So I kind of made this one up. And it's a little bit simplified, but you had a hospitalization. You went to your hospital, and you were there for one night. And while you were there, you got a CAT scan and you got a tier 4 prescription. And then a little bit later, you had a PT visit subsequent to the hospitalization from friendly PT associates. So you can see you run across the hospitalization. There are these codes that they tell you sort of how they've adjusted the claim. You can see that the hospital charged $30,000 for your hospitalization. But because it's an in-network hospital, the allowed amount is $18,000. So they've reduced $12,000, which is that not payable column. And out of that $18,000, the plan paid $15,407. Now, how did they get to that number? Well, you keep looking over, you see the first thing that they did is they applied the deductible. And in this case, and I just made this up, the consumer had $2,093 left on their deductible. So they've paid their deductible in full by paying $2,093. And then they also have that $500 copay that we talked about earlier. So their total payment here is this figure here, the combination of what they paid to finish their deductible and the copay. So they have to pay this $2,593, and then the plan pays the remaining $15,407 to get to the allowed amount of $18,000. Similarly, for the CAT scan, they've applied a code. The CAT scan was billed at $4,000. We're saying that they'd negotiated a $1,000 payment per CAT scan with this hospital. So $3,000 is not payable. And then the plan paid $925 because there was this $75 copay, which is the total that this consumer has to pay because they've met their deductible previously. The tier 4 RX prescription is covered. They've applied this code, and we don't know what these codes mean. A lot of times consumers get these ROIs, and the codes are kind of inscrutable. There's sometimes explanations at the bottom, but we don't know what they mean. We have to or you don't know what they mean. The consumer often doesn't know what they mean, and we can scrutinize them, and sometimes we can tell, but sometimes we have to ask for more information. So in this case, the RX cost $1,600 for the prescription. It was negotiated down to $900, which means that $700 is not payable. The plan paid half and the consumer paid half because they have that 50% copay that we talked about after they've met their deductible. And then later, again, they had a PT visit, which was billed at $300. It was written down to $125, and the plan paid $45 because the consumer had that $30 copay. So this is a lot of the sort of the key information that we want to look at when folks come to us and they say, well, I don't know why I was being charged so much and my insurance didn't cover something. And sometimes they covered it, but it was subject to your deductible or you have a copay. And looking at the EOBs here, we can see when when the insurance company has applied it to the deductible, which doesn't mean it's not covered. It just means that it's your part, it's the consumer's part to cover before the insurance will kick in. Sometimes, though, the explanation of benefits includes a denial. So I'm going to go to the next slide. And in this case, the consumer had 2 procedures. They had one done by a Dr. Jane Smith, who charged $5,000. And Jane Smith, the plan says, well, we don't think that was necessary, and we have whatever reasons we have. And so they say the whole thing is not payable. The plan pays $0, but they also say that you pay $0. And the reason for that is because Dr. Jane Smith is in your plan's network. which typically, not in every case, but typically means that the in-network provider has agreed to hold harmless the patient if the care is not medically necessary. In other words, it's the doctor's job, it's not the patient's job to know when care will be medically necessary. Doesn't always play out this way. There are a lot of wrinkles to this, but this is, in the simplest terms, this is how it's supposed to work. By contrast, Dr. Brown over here did a procedure. They applied this code, which you'll note is different. He charges $4,000, and again, they're saying it's not payable. But in this case, they're saying that the consumer is going to have to pay that $4,000, and the reason why is because Dr. Brown is not in your network, and so he is therefore entitled to balance bill you. And they're just reflecting that. So this is a lot of the information that we look for when consumers come to us, and we ask them if they could bring their explanation of benefits with them, because it tells us a lot about what's going on in the case, even if we don't know, and sometimes we do know, but even if we don't know exactly what the codes mean, just being able to look at this matrix of how the benefits were applied can tell us a lot. The last thing I want to say is that the explanation of benefits doesn't just include that chart. It includes 3 or 4 pages of sort of words at the bottom that folks are probably inclined to throw away. I want to encourage you not to throw them away, to keep all the pages of your explanation of benefits, because it includes things like your appeal rights, right? It'll tell you you have 60 days or 90 days if you disagree with our decision to appeal. Sometimes it's as much as 180 days to appeal our decision. And we need to know that, because that helps us to know, do we need to write something this week or, next month? It will include information about what laws apply, right? So sometimes folks are insured by a plan that is, their employer is in New York or Massachusetts or Wisconsin, and they work remote, or they, drive over the border to New York or Massachusetts. It's helpful to know what laws apply, because different states have different consumer protection laws. And sometimes the words, the pages that you're inclined to throw away include explanations about what those codes mean, where they say, they'll say this was, applied to your benefits. They'll say this was experimental or investigational or something like that. And that at least gives us a sense of what kind of arguments we may need to make to try to convince the insurance company to overturn it. So just as a recap, here's what we learned. We learned to think about health insurance as a financial product. It smooths your cash flow. It's not the same as care. It's more about being able to pay a small amount each month rather than just being at risk of a major catastrophe. We learned some meanings of some of the key terms that health insurance uses and that you'll see on your explanation of benefits. Those being the allowed amount, the amount that the insurance will pay for the covered claim, the deductible, the copay, and the co-insurance. The difference between those last two is that a copay is defined as a dollar amount and a co-insurance is a percentage. And then we talked about how to read the summary of benefits that you get and how to read the explanation of benefits. So with that, I have a few minutes. I know we covered a lot. I covered it kind of quickly, but I'm here to answer a couple of questions if folks have questions. I think, and Denise will correct me if I'm wrong, people can put questions in the chat, or I don't know if they, okay.
I don't see any questions in the chat at the moment, but you guys
So
have
I just, sorry,
Kathy.
I just wanted to mention that sometimes you may see an explanation of benefits also referred to in the Medicare world as a Medicare summary notice. So with traditional Medicare, the explanation of benefits is a Medicare summary notice. If you're in a Medicare Advantage plan, one of the private plans, they do refer to the document as an explanation of benefits.
Thank you for that note, Kathy. And that is Kathy Holt, our healthcare advocate and my boss for the next 2 weeks until I leave for DSS.
We're sorry to have you go, Adam.
Well, you're very kind.
Our loss is DSS's gain. So at least you're
I
still
will
staying
miss
with the
this
state.
place. I will miss this place, and I'll definitely be in touch. All right,
Are there any other questions?
Hi, this is Lisa. Can you hear me?
Yes.
Yes.
Okay. And I'll take this offline. I have some teachers who do not have, they have under 40 quarters or no quarters of Social Security, and they're curious about what their options are for health insurance. Is that something your offices might be able to assist with?
We are working on that, and Adam's taken the lead. So happy to talk to you, Lisa, about the progress that we've made with that.
Okay, all right, so I will grab you afterwards, because I just got a call about 34 individuals that just really don't know what to do, that are teachers and need
In
to
New
know their
Britain, I'm
options.
sure that's the number that we
Yeah,
keep hearing. Yes.
Okay. So,
Yes.
yeah, I'll email you offline.
Thank you.
Thank
Perfect.
you.
Thank you, Lisa.
All right, I put the contact information again in the chat, if anyone needs it. Thank you for joining us. Great job, Adam. And join us again next month. Our health advocate, Kathy Holt, will be doing a presentation on buyer's remorse, Medicare Advantage disenrollment options. So we will see you again next month. Have a great rest of your day, everyone.
Thank you so much.
Thank you.
Thank
Thanks,
you.
Adam.
Bye.